Welcome to the 2015 Wren Convocation of Practices, developing a roadmap for optimum patient-partnered chronic condition management. Now, this conference is a little bit different than most medical conferences where people go to have their heads filled with knowledge. We're not here to give you knowledge, although we hope you get some, but we're really here to engage you to think about what we don't know, what's inadequately asked or answered. And we want your help to develop a path forward for where Wren should go. In a few minutes, I'm going to introduce our first plenary speaker, Dr. Neese, who will address the question of why did we choose chronic conditions, but I want to spend just a few minutes describing who came to this conference. So, who is here? Well, we have 135 folks from all over Wisconsin, which I think is really impressive. We also have a handful of people from 6 additional states, and we even have 2 people who signed up for this meeting from overseas. Unfortunately, the gentleman from England who had refractory asthma became ill and was unable to travel. It sort of illustrates some of the burden that people with that condition can experience. But his story is in the end of our book if you care to read it. Now, we are all patients. So that's really where I want to go with this. But many of us have other professions. Many of us are clinicians. Many people in this room work in clinics or administrate clinics, are nurses, are patient advocates, work for government, industry, students, public health, and insurance. So I just want to really thank you all for coming, and we value all of your perspectives. So today, we're going to be trying to stimulate the little gray cells by having presentations, and tomorrow we're going to ask you to work with participating in a World Cafe about topics, approaches, and partners needed for our future research. After the conference is over, we will be asking selected folks to commit time to developing the research approach, writing it up for publication, and working with partners to implement it over the next 6 to 8 months, with an ultimate goal of finding new approaches that Wren can pursue in the future to hopefully improve health and healthcare. Now, I want to say a few words about research for those of you for whom it's not a profession. It may seem intimidating at first, that word. Oh my gosh, look at this. This is kind of one diagram of the research enterprise. However, I think the basic principles are more simple and easy to understand. The way I think of research is something goes in, there's a black box where researchers do their thing, and something comes out. What goes in is a research question that's asked of a certain group of people. There's lots of approaches and methods that go into the black box, and then there's an output that we call evidence or answers, and I think it behooves you all to think about what really matters to patients, what evidence really matters. We're going to be touching a little bit on approaches, just a small amount tomorrow, but the most important things that we want your opinions about are what goes in and what comes out. What are the most important questions to answer, and on who should they be studied? Who should we study, and then what are the answers you want out? If we don't get those right, it doesn't matter how sophisticated the black box is. You'll be getting information that's basically irrelevant. And a couple of words about stories. I'm hoping that we will hear everyone's story in the next couple days. These are some quotes that I like. In order to make events comprehensible, humans relate stories. for this universal form of communication unites actors and actions in an intelligible form. And I hold, with this second quote, that research is simply the working out of a universal story from all of the particular stories.